Okay, good morning, and good morning to anyone who's watching, or hello to all who are watching. I'm here with Roy Cummings, and I am Dr. Cindy Collins, once again doing an interview with a cancer patient. And often I like to talk with patients who really are also in survivorship, which can be very complicated because there could be some chronic issues or other diagnoses, etc. But that point of this is to hear survivor stories because they really understand what you're going through when you're newly diagnosed or when you're in the middle of treatment. And this is a way you can kind of get to know somebody. And I'm going to give you an email address before we finish in case you ever have questions and you want to ask something of Roy or myself. We'll always be available to answer your emails. So, hi, it's great to see you again. How long? We've
Yes,
known
hi
each
there.
other for several years, right?
2016.
There it is.
Yeah,
2000. Wow, that's
a
amazing.
long time ago.
Hmm.
Yes, we really appreciated your nutritional talks once a week. They were very informative. I
Thank
learned a
you.
lot how to take care of ourselves and keep our health, on the upbeat.
Hmm.
So before
Hmm.
my diagnosis, I was not um, keeping up with. I would take a multivitamin, and
Hmm.
that's about it. I would see my primary care physician and my endocrinologist for diabetes type 2 I have. So
Okay.
that was just controlled with metformin at the
Hmm.
time, and I'm still just type 2, thank God.
Hmm.
Yes,
So that's your pre-cancer. That's all you were dealing with is your diabetes, which is important, but still diabetes. And like you said, you weren't really focused on being super anti-cancer. You were just living your life, right?
Yes, it didn't enter my mind at the time, about
Hmm.
cancer. Um,
Hmm.
and then I was partying on the weekends, with my wife. We'd go out and have a few wines or mixed drinks and
Hmm.
not really caring. The furthest thing from my mind was
Hmm.
cancer.
Hmm.
And I went to a urologist. I would go to him as a precaution every 6 months, just
Hmm.
as a precaution. And actually, he's the one I credit with finding the problem to begin
Hmm.
with.
Hmm.
He's seen my PSA was starting to rise. And he went further. We did a test with testosterone.
Hmm.
He injected some testosterone,
Hmm.
and my PSA went up. He withdrew the testosterone medication for 2 weeks,
Hmm.
took another PSA, and it went dropped. Then he
Oh,
went back and included it again, and when it went up, he said, "You have some cancer in your prostate because
hmm.
it's cancer feeds on testosterone."
I see. So it's like a provocative test then. And for you,
Yes.
just for other patients who might be listening, before you had that knowledge that your PSA was going up, did you have any other symptoms at all that you were complaining of, like frequent urination or
Oh,
anything?
no, not really. Um, uh, I didn't have any pains or
Hmm.
frequent urination.
Hmm.
Uh, I really didn't have anything. I was tested, to see how much testosterone was in my system,
Hmm.
and it was kind of low. That's why we were experimenting with the injections.
I see. Okay.
So when it went up,
Hmm.
so he suggested getting a biopsy,
Hmm.
and it came back. The Gleason score was 5 and 5.6,
Okay.
so that was concerning. So he explained that if I went ahead with radiation, I'd have a 98, 99% chance of whipping it, getting rid of it.
Hmm.
I had the option of waiting, watch and wait, but I opted for the radiation treatment. He did another biopsy, and it came out that I did have some cancer in my prostate. So we went ahead with the radiation treatment. I had the option also at that time of either getting, I think they called it a gamma knife. At that time, it was some kind of other radiation
That's
where
right.
it was only
Yes.
5 treatments
Hmm.
or up for the 44 treatments.
Hmm.
So I took the 44 treatments daily, 5 days a week.
Okay,
So
that's a lot of treatments, right? And that's 5 days a week, weekdays. Do you remember
yeah,
why you took that over the gamma treatment? It's been a while now. I don't know if you recall.
he, yeah, my urologist said you could do either one,
Mm-hmm.
but he was more familiar with the 44 treatments,
Okay.
and he knew about them. But it was up to me. He said either way, but he would go with the one he was more familiar with.
Mm-hmm.
But so I did, and it's only 10 minutes, each time. It was
Yeah.
close to my home,
Mm-hmm.
so it was okay. It was convenient.
Mm-hmm.
So
Yeah.
so
Just have to go in every day. But like you said, it's longer to get there and get on the table than it is to have the treatment, is what I hear. Right?
yes,
Yeah.
yes, it was, and there was no side effects at all.
Mm-hmm.
So that was a very good outcome at the
Mm-hmm.
end,
Mm-hmm.
and I had Dr. Hahn.
Oh,
He was
yes.
very
Mm-hmm.
good, very understanding.
Mm-hmm.
After the treatments, I met him yearly, and
Mm-hmm.
then he would do a PSA, and
Mm-hmm.
up to 5 years. After 5 years,
Okay.
he released me and said
Mm-hmm.
that was it.
Mm-hmm.
I should be okay, but
Mm-hmm.
continue getting a PSA at
Mm-hmm.
least yearly.
Yearly. Okay.
Yeah.
And so during this time, after the treatment or after the diagnosis during the treatment, who was on your support team?
Well, it was mostly just our weekly meetings, really, when we
Mm-hmm.
got together.
Mm-hmm.
Even though you gave a nutritional aspect to it, we
Mm-hmm.
all got together and exchanged stories.
Mm-hmm.
So I had learned a lot from that.
Mm-hmm.
Most of the people with prostate cancer are a little older, like
Mm-hmm.
myself.
Mm-hmm.
When I got, let's say I'm 84 now. So
Mm-hmm.
now so I was about 78.
Mm-hmm.
So that was, I learned a lot. We had our oldest member. I remember he was like 91. I
Yes.
think, and he
Yeah.
was a hoot. He
Yeah,
had
he was.
stories. He was funny.
Hmm.
We
That was a
lost a
lot of
few.
fun. Go ahead.
Yeah, we lost a few along the way, but not
We
too
did.
many.
Hmm.
Not
Hmm.
not not too many. It's not as aggressive if you catch it early.
Right. And then the Gleason score, that can give you an idea of how aggressive. And the nice thing is that we did talk about nutrition, but people also shared their experiences, their feelings, and compared notes, maybe even on what their doctor was saying, just to, I feel like the support group for prostate cancer is so important. And I know a lot of people think, well, I don't need support, I'm fine. No, but it's not so much that you have a psychological need for it in the sense that you're not coping. It's just that it helps to enhance your coping because you get a lot of information, first of all, and you can clarify your
Uh,
information. And then you guys built friendships as well. As the years went on, I felt like a lot of friendships were formed. Did you have a support group at home too? Did you have people in your family and friends supporting you?
no, not really. They didn't
Okay.
understand, and it wasn't. It seemed like it wasn't that bad. So,
Yeah.
and I was confident I was going to have a
Yeah.
good outcome.
Yeah.
Catching it early.
Yeah.
Um, some of the men in our group, as you know, they put off going to a urologist and getting
Hmm.
checked, and they're the ones
Hmm.
that had the worst outcomes.
Yeah,
But
that really is true. And I think you said another thing that's very important that, especially with prostate cancer, you don't really look like you're not well. There are no signs that you're having an illness or anything like that. Typically, your energy level is fine. You can go about doing life as usual. So I think, like you said, people don't really understand because they don't really realize, like, okay, I don't see any difference in you. It looks to me like you're okay. And yeah,
yeah,
so it's a little different than other cancers, I think, where, somebody can get very debilitated and, things like that. So, yeah, sometimes with prostate cancer, you wouldn't even guess that somebody had it. So you don't always get a lot of people inquiring about you. How are you doing? And, that kind of thing. So,
Yeah, that's true. You
mhm.
don't lose a lot of weight usually,
No.
so
Hmm.
it's
Hmm.
and the after effects of it, you got to keep an eye on it.
Hmm.
Get your PSA checked, see
Hmm.
your urologist.
Hmm.
Some people still get the digital exam from the
Hmm.
urologist.
Hmm.
I've read pros and cons of it. You know,
Hmm.
some say they could miss, even if you have a prostate cancer and lumps, um, the urologist is only feeling what he can reach with his
Hmm.
finger. And
Hmm.
sometimes they can miss the tumors or growths could be on the other side of the
Hmm.
prostate gland.
Hmm.
So they don't see it, where the PSA will pick it up,
Okay.
you know.
Hmm.
So I know one of our group that Harvey. I
Yes.
spoke with him yesterday, and he
Hmm.
still insists on a digital exam
Hmm.
yearly
Hmm.
because he has confidence and he wants to hear the urologist say, "I don't feel anything."
Yeah. So yeah, he
So
wants the good news.
yes,
Yeah.
so
Yeah.
my urologist it takes the opposite effect.
Uh-huh.
If my PSA isn't rising, he doesn't worry about doing a digital anymore.
Okay.
So I guess they're all up. They have their own beliefs.
Hmm. Hmm.
So I don't know. I don't know why they can't get like maybe a PET scan and an
Hmm.
MRI of the prostate gland
Of
to
the
see if
area.
there's,
Yeah.
yeah, that area. I don't know if it's blocked by another organ
Well, I
like
would
the
think
colon.
that probably they don't think it warrants that, which is a much more involved thing to do, as long as the PSA is that determinative. So if you can just have a PSA test, which costs less, takes less, it's less invasive, it's less work and everything, maybe that's why. But that's exactly the kind of information that gets shared in a group, isn't it? Because now
Yeah,
each person in the group would go back to their doctor and say, why don't we do an MRI, or why are we doing the PSA, or why are we doing the digital? And like you said, they all have their, meaning the different oncologists and urologists both, they all have their own idea of what the best thing is. So it's so important to go back to your doctor, right? And talk to your own
yeah,
doctor about and like you said, you had confidence. You had confidence in your treatment and your doctor and that you were going to do well.
yes,
You
I
never
did.
lost that confidence at all, right? You never had
No,
any, yeah.
catching it early.
Mhm.
Now I read they have like a block where
Mhm.
it's a procedure. I guess it's a mini operation, and they put it
Mhm.
between your colon and your prostate, so
Uh-huh.
that if you have radiation, when you do, it won't penetrate into your colon and
Mhm.
have the risk of getting a colon cancer. But
Mhm.
it's like a mini operation. It's called
Mhm.
a prostate block or
Yes.
colon block, right?
Yeah. Mhm.
Something like that.
But it
That's a
is
new
like
thing.
it is, yes. And it
Yeah,
is like a small operation just to get that inserted and put in place. But yeah, the
yeah,
idea is to protect. And some people with prostate cancer treatment, they depending on the how aggressive the radiation is, they might have a little bit of a loose stool or some irritation or pain with urination, things like that. But nowhere near
yeah,
like it used to be because it's so pinpointed now, where it is.
yeah,
So yeah, so it's really, but like you said, early detection, early treatment, don't wait on it is probably the best way to go. So after you
yeah.
finished treatment and you were going along your merry way until, right?
Yeah. Well, I had another brush with cancer. It was a mucosal melanoma, and
Okay.
that was anal. I started having bleeding and
Mm-hmm.
very painful pains back there. And so I
Mm-hmm.
went to a very good gastrointestinal doctor.
Uh-huh.
Unfortunately, he put me with someone that was young. I think he was probably just out of medical school, maybe.
Mm-hmm.
He was very nice, though. And he looked there and said, "Oh, you have an anal fissure, a
Mm-hmm.
fistula, and
Mm-hmm.
just above the sphincter muscle, and that
Okay.
was causing the bleeding."
Mm-hmm.
So they were just treating me with a cream,
Mm-hmm.
but the pain and the bleeding continued. I got
Mm-hmm.
weaker and weaker, and this went over a time of about 2 months.
Oh gosh.
And then finally, I couldn't eat anymore. I couldn't drink. I was so
Mm-hmm.
dehydrated and weak. So my wife called the ambulance one Sunday. I went to the hospital.
Mm-hmm.
They did blood work and they said, "Oh, you're fine. I don't know what it is." But then they said, "Let's do an MRI, I'm sorry, a CT scan just
Mm-hmm.
to make sure." And when they did, the results was I had cancer all in my pelvis. They called
Mm-hmm.
it peppering. It's all little mini, like mini tumors. And
Okay.
then in my liver, I had four big ones. And
Mm-hmm.
then on my anal sphincter, I had a growth.
Okay.
So when the doctor came in, I was still naturally in the emergency room
Wow.
when they,
Mm-hmm.
when they brought me in. And he said, "There's nothing we could do with you here. I'll give you about 5 months to live." And
Oh
he
my
said,
gosh.
"We're going to unhook you from the IV and you can go home."
Mm-hmm.
So with that, I was very depressed. As a
Mm-hmm.
matter of fact, I was 80 years old. That was in December. So
Mm-hmm.
I was 80 and I went home and I said to my wife and my youngest boy, I said, "Well, I had 80 good years and, I faced it like that. I
Mm-hmm.
figured that was the end." But anyway, I got another doctor and
Mm-hmm.
a regular concierge doctor.
Okay.
And she said, "Let's go further." So I got a proctologist. He
Mm-hmm.
sent me in for a colonoscopy. And when I came back, he said, "You have a growth there." So they sent
Mm-hmm.
it out and had biopsies done at
Mm-hmm.
different institutions. And it
Okay.
came back mucosal melanoma, which is
Okay.
very rare. Only
Mm-hmm.
1% of people get it. That's roughly 700 people per year in the United States.
That's
So,
all. My goodness.
so they sent me right in for 5 rounds of radiation to that
Mm-hmm.
area. And I'm telling you, I was in such pain before that for like 3 months. And they were giving me all kinds of opioids and
Mm-hmm.
pain pills, nothing touched it. But
Mm-hmm.
after the second radiation treatment, the
Mm-hmm.
bleeding stopped and the pain went away. I
Oh my
couldn't believe it.
goodness.
It was like a
Wow.
miracle. So
Mm-hmm.
I had the treatments, 5 radiation treatments, 5 days in a row. And the following Monday, I started Opdivo.
Mm-hmm.
That's a cancer infusion drug.
Okay.
It's a new immunotherapy drug.
Mm-hmm.
They've come a long way in my 5 years since
Wow.
then. But
Mm-hmm.
within 5 months, it killed all the cancer cells. It wiped them all out. The radiation took care of the anal fish tumor. That was
Okay.
my main one. That took that out right away. So
Goodness.
I was very fortunate. So I continued on immunotherapy for
Mm-hmm.
2.8 years. They
My
only recommend
goodness.
2 years,
Okay.
but I kept going.
Oh, I
You know,
gotta ask you about this for a couple of things. One, so you never had surgery then of the tumor that was in
no,
the anal area. The radiation shrunk it completely or enough that that's
yes,
amazing. And then that added to the immunotherapy wiped out whatever cancer was there. And you even went some extra months. I guess they saw how successful it was. They wanted to be absolutely sure they got everything. But what
yeah,
amazes me is you and your character and your ability to hear. First, one doctor's treating you for a fissure, and then you realize this has got to be more than that. And thank goodness your wife got you into the emergency room. But then he
yeah,
gives you a death sentence, basically, 5 months, and get your affairs in order, and you're
yeah,
accepting it for what it was, grateful for the life you had. But this next doctor said, "Let's go further." That's amazing. Were
yeah.
you surprised by that, or when he said that, did you at any point think, boy, these other doctors didn't take care of me, or were you always just positive and moving along? How are you dealing with all of
No.
that?
Well, I learned over the years you have to be your own advocate.
Okay.
For instance, my oncologist, he's at, I won't name the place, but they're very good. So I
Mm-hmm.
guess I could. But he never treated a mucosal melanoma patient. So he
Okay.
didn't know much. So it was up to me, I think, to learn all
Mm-hmm.
about it, which I did.
Mm-hmm.
And when I would go to him, he was very open-minded and he
Mm-hmm.
listened to me and he incorporated
Mm-hmm.
some of the things that I suggested and they
Mm-hmm.
worked.
Mm-hmm.
And actually, he was more stoic in his treatment.
Okay.
Um, the nurse practitioner, my nurse coordinator,
Uh-huh.
also was more positive. The first
Okay.
time I went to sign my admission papers to the treatment,
Uh-huh.
she seen, I guess I was very despondent in my
Mm-hmm.
looks. That was when
Mm-hmm.
it first started.
Yeah.
And she knelt down beside me and said, "You know, Roy, if this doesn't work, we have a lot of other things. We're not going to give up on you. And we're going
Oh,
to beat this thing." And that
yeah.
little pep talk made me feel
Mm-hmm.
really good because
Mm-hmm.
my oncologist at that time, he wasn't sure. He wasn't
Yeah.
very sure, what we were
Yeah.
doing. And
Yeah.
he was very surprised at the results.
Mm-hmm.
So I
And
had a liver biopsy.
mm-hmm.
Um, that's always an adventure because you're not put out. I guess you could be.
Yeah, but you don't
So
have to be. So.
yeah, to make sure it
Mm-hmm.
was the same
Mm-hmm.
tumor mutation that was
Mm-hmm.
in my from the anorectal,
Right.
and it was.
Okay.
So
So that's
they
all of that is such great information. I just want to stop you for 1 second because for
yeah
those who are listening, number one, you can get a doctor that's not experienced in your type of cancer. That can happen. And that's
yeah
okay because there's a lot of information out there. But like you said, you became very well informed. So, were
yeah.
you reading up on it, and how did you learn
Yeah.
about it? By reading and organizations or internet, or what did you primarily do?
Well, I went to Dr. Google at first, and they
Uh-oh.
say don't do that.
Yeah.
Uh, it was very negative news.
Yeah.
But fortunately, I don't know. I think I was on Facebook just by accident, and I
Okay.
found a group, and it was
Okay.
Mucosal Melanoma Warriors,
Okay.
and I joined that, and they were a lifesaver. They had so much
Yeah.
information. I'm still
Mm-hmm.
with them. We meet
Mm-hmm.
twice a week,
Mm-hmm.
and we help other patients when they
Mm-hmm.
join and give them good information
Mm-hmm.
and what
Mm-hmm.
works and what doesn't. So,
Exactly. That is one of the best kept secrets out there is that some of these Facebook groups or other support groups, and they can be in all different organizations, are so valuable because they do have patients who continue to come back and help the new patients. And they've already tried out all these ideas, or they're coming from big centers or doctors who are well informed. I'm really amazed
uh,
that you found one, but I've been so impressed with these kinds of groups because they can tell you specific doctors, specific medications, specific treatments, and you can go back to your doctor and advocate for yourself. I'm very impressed that you did that, and I'm so impressed with these groups. And obviously, it worked for you. That's
yeah.
amazing.
And one thing I'd like to say is I think 50% of my recovery was through faith.
Mm-hmm.
I believe I've always believed in God, but
Mm-hmm.
when this thing hit me, I really laid in bed and I was in such pain and I prayed
Mm-hmm.
a lot. And,
Yeah.
and, and I also believe in that helping
Mm-hmm.
a lot.
Absolutely.
I mean,
Absolutely. So
some
such
people
a
aren't religious.
Yeah, but we know a combination of information, even with a stoic doctor, and then just look at the hope that the nurse practitioner, the nurse care coordinator gave you with her pep talk. So we know
Yeah,
that our faith and our belief system, so obviously, like you're saying, but we know it from talking to patients, but you know it firsthand, how much your faith and the way your outlook was. and the hope that you
Yeah.
were able to arrive at, along with the medication. You're a testament to that. It's amazing.
Yes, you have to have a positive outlook and
Yeah.
always believe in your mind you're going to
Mm-hmm.
beat this thing. And that was the
Mm-hmm.
furthest thing from my mind at the
Mm-hmm.
beginning.
Mm-hmm.
But then little by little, I
Mm-hmm.
got there.
Mm-hmm.
And now I could help other people. But they've come so far, with all types of cancers.
Mm-hmm.
They're helping everyone, and I
Mm-hmm.
believe AI is going to make a big difference also in cancer and all development in diseases
Mm-hmm.
around the world.
Mm-hmm.
And very,
Yeah. So
it's,
some patients are using AI now to look up their diagnoses. You probably know that, and they're just
yes, I do
checking it. They're
that.
even putting in their data from their scan, for example, and seeing what it says. You
Yeah,
just still go back to the doctor, with the information,
yeah.
but still it gives you some hope, gives you some idea. Yeah, and have you seen the treatment you had? You said it was the Optivo. Are they still using that treatment now, do you know, or have they moved on to other medications with your type of
No,
cancer?
that's the main maintenance dose
Okay,
medicine.
okay.
I was getting it intravenously at first, and the doctor recommended getting a port in my chest up here. So
Okay.
they infused it there. It
Mm-hmm.
mixes better in your blood. So I got that done after 2 months, and
Mm-hmm.
I'm glad I did. They could
Mm-hmm.
also take your blood results,
Mm-hmm.
out of there. So
Mm-hmm.
I did that. I had it removed now because I don't need
Mm-hmm.
it.
Mm-hmm.
So I go for tests. I was going for PET CT scans
Mm-hmm.
every 3 months. Then it went to four
Mm-hmm.
months,
Okay.
then 6 months. So now I go next month for my 6 month. And he said, if that's clear, we'll go to yearly. So
Amazing.
I don't know. I
Amazing.
think I told him I want to stay with 6 months because when this comes back, it comes back quickly and with a vengeance because you always got to keep checking. And
So that
and I'm the oldest guy in my group.
are you?
And on the other spectrum, the youngest is a 24-year-old
Wow.
mother. She has anorectal, and she just had a baby, and the
Oh,
baby is not a year old. I
oh
feel so
my.
sorry. She's
Mm-hmm.
such a beautiful woman and loves
Mm-hmm.
her baby and wants
Mm-hmm.
her and her husband plan to have more. So I hope
Oh
her
my.
treatments work. She just
Mm-hmm.
started her treatments, and I'm
Mm-hmm.
sure with her young age and positive
Mm-hmm.
outlook, she'll
Mm-hmm.
come along and beat it.
Yeah. And then so you probably repeat your story a lot because when you tell your story, that would really give hope to other patients because when they see you and you look healthy and you feel good and you're thriving now, and when you let them know that you had such a poor prognosis at first from one doctor, but that moved
Yeah.
into, working for it. It's just amazing, what can happen. It's beautiful.
Yeah. And most of the people in our group have the same prognosis
Okay.
at the beginning when they
Is that
first
right?
found out. They were all
Mm-hmm.
given the same short
Hmm.
lifespan, five
Mm-hmm.
months, 6 months, at the
Mm-hmm.
beginning. So
Mm-hmm.
that goes to show you that they didn't know the doctors at that time, the
Yeah, that's right.
oncologists.
Mm-hmm.
They have a few big um, cancer hospitals
Mm-hmm.
in the U.S. MD Anderson is probably the biggest in
Okay.
Texas, and
Mm-hmm.
you have Sloan Kettering in New
Mm-hmm.
York,
Mm-hmm.
and they have a few. There's one in Colorado,
Mm-hmm.
and they have Dana Farber in Boston. They're
Mm-hmm.
very up on mucosal melanoma.
Okay.
So if you have also over here, you have the one on the West Coast in Tampa,
Uh-huh.
that one there.
Mm-hmm.
Um, they're pretty good.
Oh, Moffitt Cancer Center in Tampa,
Moffat,
Moffitt. Yeah.
they're
Mm-hmm.
very
Mm-hmm.
forward thinking. There's a
Mm-hmm.
new process they have. It's called TILS, TILS,
Mm-hmm.
but they don't have a complete response rate is only 5%. But people are
Mm-hmm.
gravitating to get that, and it's a very rough treatment.
Mm-hmm.
Um, but they have a partial response rate that's
Okay.
almost 55%. So
Mm-hmm.
that'll hold, the cancer in check,
Okay.
for quite a while.
Mm-hmm.
So it's an
So
ongoing thing.
it's ongoing. So that brings up the other piece is that so many people who haven't had cancer think that you have it and then it's just cured. And we don't even
Yeah,
really use the term cured anymore, but we say remission or no evidence of cancer or things like that. But you're
yeah,
indicating that sometimes with certain kinds of cancers, you'll have to keep a really watchful eye. Like you'd like to have your scans every 6 months. You don't want to extend it to a year so that you don't have all
yeah,
that time going by. But also, you might end up living more years if God forbid it did come back with different medications. And I think
yeah.
that's opened up a whole new way of living with cancer in a
Um,
way, in spite of holding it at bay, like you said. It holds the
right,
growth down, holds the recurrence or the spread down, but you go on living your life, but you might be on a medication. So,
right.
and how do you feel about that? Would you be okay? Are you all right doing that? Or what's your take
Yeah,
on that?
yeah. You have to be positive and live your best life every day. That's
Uh-huh.
what we say. That's our slogan. Enjoy
Uh-huh.
yourself. Enjoy your life.
Mm-hmm.
Mucosal melanoma, they call it mucosal because it's in the mucosal lining of
Uh-huh.
your insides. It's
Mm-hmm.
not on the outside. So the number one place is anal. For
Mm-hmm.
women, it's vaginal. And
Mm-hmm.
then for other people, it's in the sinus. A lot of
Mm-hmm.
people get it in their sinus, which is
Mm-hmm.
very bad because it easily spreads to your brain from
Mm-hmm.
there and your
Mm-hmm.
eyes. But
Mm-hmm.
they get right after it.
Mm-hmm.
So
Mm-hmm.
it's an unknown, but they have the most progress in
Mm-hmm.
finding a cure for that. I
Mm-hmm.
think prostate cancer, I don't know how much they're doing on that to
Mm-hmm.
explore what can you do. You can't really um, get an injection for it, right?
Mm-hmm.
There's
Right.
nothing
Not
that,
really. So there's fewer treatment options when it comes to prostate cancer. Basically, it's radiation or surgery. That's basically what the options are. And when
yeah,
it does recur, then could be recurring in the bone, for example. And then there are other options at that point. But it's not like your mucosal cancer where they have really aggressively looked for other chemotherapy, other immunotherapy. At least it doesn't seem like there is much happening in that field. But with all the
yeah,
different types of cancers, it sounds like you feel really positive that, especially with research and AI, that there'll be more and more that we can do to help people with cancer from your experience.
yeah.
Mm-hmm.
And they're doing the most testing, I think, in breast cancer
A
right
lot of
now
testing. Mm-hmm.
and lung cancer. They're the two
Mm-hmm.
biggest ones,
Mm-hmm.
which kill the most people,
Yes.
those
Mm-hmm.
two. So
Mm-hmm.
they have the most scientists looking into
Mm-hmm.
that.
Mm-hmm.
And I think in the next few years, that's we call extending the landing strip. So
Yeah.
when you have something, the longer
Mm-hmm.
you could live, the more
Mm-hmm.
chance you have of them
Mm-hmm.
finding a cure for you.
Mm-hmm. That's so true. It's really true. And you have to hold on to that. And I'm wondering about your way of coping with everything and having such a great perspective and an optimistic outlook. Do you think that your life before cancer prepared you in some ways, just like overcoming other challenges in life, that you had a track record of how you dealt with things? Do you think that in some way had prepared you to deal with cancer?
Well, no, I back in 2011, I had Legionnaire's disease,
Okay.
which I almost died from.
My goodness.
I was in the hospital and a rehab center for a total of
Uh-huh.
3 months.
Goodness.
So
Okay.
I survived that. Uh, and I kind of like put my hands then too in the hands of the Lord. And whatever would happen, I just put myself and figured it was faith. what would happen. I
Mm-hmm.
would fight, maybe my body would fight it,
Right.
better, much better if you have a
Mm-hmm.
positive outlook.
Mm-hmm.
Because I love
Mm-hmm.
life. I love the
Yeah.
sun.
Mm.
And I love this, just watch wildlife. So
Mm-hmm.
you have to love life
Mm-hmm.
at its simplest forms.
Mm. Mm-hmm.
That helps.
That makes a lot of sense. And I have heard other survivors, especially with poor prognosis, who've done beautifully, say exactly that. You have to find what is life for you, and then
Yeah,
really each day love life and then, pursue
yeah,
life. And that seems to really set your perspective differently. You don't
yeah.
get overcome by the sadness or the worries or the confusion. At any point, did you think, I think we need to let doctors know this or let medical personnel know this so that they can be better at communicating with patients or anything like that? Like, if you had a chance today to talk to a room full of doctors or other professionals, is there
Uh-huh.
anything you would say to them to help them with cancer patients?
Well, about once a month we have meetings with Zoom, and there
Mm-hmm.
are different oncologists. So they take questions and answers.
Uh-huh.
First, they tell us about the progress and how much funding they're getting
Mm-hmm.
to explore the benefits of treatment. But at the end, they allow time for questions and answers. So we
Mm-hmm.
have a chance to ask them that. And we
Mm-hmm.
explain things. And they're very up. The ones from Sloan Kettering and MD Anderson, they're very up on things, and they
Mm-hmm.
listen to all the
Mm-hmm.
patients, the cancer
Mm-hmm.
patients. So they're pretty good.
Yeah, so that sounds like good advice. So listening,
Yes,
hear
my
the
my
message.
my oncologist. If the first time I mentioned, oh, I was on Facebook, his eyes rolled. They don't want to hear that.
Right, right.
And
But if you're a discerning person like you were, you're not just going to listen to any old stuff, but you're going to listen
uh,
to someone who has experience, has some facts, has some information, you know. So,
yes, like we tell the newcomers to our Zoom group when they sign on, we say you have more experience with this group than all the oncologists you'll ever see.
uh-huh.
Right, it's right here on the screen,
Mm-hmm.
and it's true
Mm-hmm. It
because what
really is
works?
true.
How many people on the treatment, to get diarrhea and the
Mm-hmm.
colitis, and
Mm-hmm.
I had pneumonitis, and it was a touch of it, and I
Mm-hmm.
kept going because I had a cough while I was under
Mm-hmm.
treatment for the
Mm-hmm.
mucosal melanoma. So I
Mm-hmm.
was going for CTs, and they kept
Mm-hmm.
saying, no, there's nothing there. Come to find out, I did have pneumonitis. I went to my pulmonologist that treated
Mm-hmm.
me years ago for Legionnaire's disease. And
Mm-hmm.
she said, you have a touch of pneumonitis. That's what's there. And
Mm-hmm.
these other doctors, they said, no, nothing's there.
Huh.
So anyway, you have to keep digging.
Yeah.
If you don't get the right answer, you have to trust your own instincts sometimes.
Mm-hmm. Right. There comes the advocating for yourself again. You can't stop at
Yeah,
just one answer. Sometimes you have to keep going. And the fact that you had the history of Legionnaire's disease, especially, you might be at greater risk for that something getting triggered. So,
yes,
mm-hmm.
yes.
Mm-hmm.
And I could have got the mucosal melanoma from the radiation treatments
Mm-hmm.
also, because
Mm-hmm.
that's right in that area. You're
Mm-hmm.
laying on your back and it's going straight
Mm-hmm.
down to your gland, and right behind it is the colon.
Mm-hmm. And has a
So
doctor, did they say
the
anything
radiation,
from the radiation? Okay. Yeah.
yeah.
Hmm. So
Uh,
sometimes patients say that there's certain benefits to having gone through the challenge of cancer. We call it benefit finding because they'll say, without the cancer, I would never have something, fill in the blank. Do you feel like now that you've met this challenge and you're meeting an ongoing challenge, are there any benefits in your life to having been a cancer patient?
no, just to help other people and
Yeah.
share my knowledge.
Mm-hmm.
Um, live life and appreciate it more.
Mm-hmm.
Uh,
Mm-hmm.
that's about all. And I read more about,
Mm-hmm.
the findings, what they're exploring new things.
Mm-hmm.
That's always it's and a challenge to educate people that just
Mm-hmm.
started their journey.
Mm-hmm.
Uh,
Mm-hmm.
so
Yeah.
anyway, that's I feel very lucky,
Mm-hmm.
but I accept life as it comes. So I've
Mm-hmm.
lived a long life. I would have never thought I would live to 84 when I was young.
Really? Yeah, look at that. You probably thought it was so
Exercise,
old.
yes. And
Uh-huh.
exercise, I've failed to mention, is a very
Uh-huh.
important part also.
Mm-hmm.
You know,
Mm-hmm.
I ride my, I pedal my stationary bike and
Okay.
do calisthenics in the morning. So,
Mm-hmm.
and walk, I just walk 15 minutes, that's all. But
Mm-hmm.
that's very important. And
Mm-hmm.
in cancer, fighting
Mm-hmm.
cancer, keep
Mm-hmm.
moving.
Yes, keep moving.
Yeah.
Absolutely is. There's so many studies now about movement, and they're not even always able to pinpoint exactly why. I mean, lower inflammation, but there's still, but it's very clearly a benefit for overcoming
Yeah.
all kinds of cancer, for sure.
And plus the gut microbiome is very
Mm-hmm.
important in what you eat.
Mm-hmm.
They found,
Mm-hmm.
that's very important.
Mm-hmm. Do
So
you
you
have
want to
any
keep it.
specific things you've done for your gut microbiome? Is there anything specific you're taking or eating?
No, I just eat a healthy diet. Naturally, I
Uh-huh.
don't drink, and
Mm-hmm.
I cut down on my colored soda. You could have like a Sprite,
Mm-hmm.
and that naturally that's sugar free, and Seven
Mm-hmm.
Up like that. Spicy foods aren't good, and any kind of antacid. All the cancer doctors say do not use that. Any kind of
Mm-hmm.
like pepsin, um,
Mm-hmm.
that's very bad for the
Mm-hmm.
microbiome.
Mm-hmm. Mm-hmm.
So anyway,
Yeah, so much information, but it's such a gift that you're giving back, that you're giving to in the Facebook group and I know you do a number of support groups and then coming on
yeah,
today too. It's just to spread your knowledge and spread your experience because it's information and it's uplifting. And people can see that it's possible to overcome these very serious cancers and still live
yeah,
and enjoy life.
yeah. And you could see the people that have a positive attitude, they have a
Mm-hmm.
positive outcome.
Mm-hmm.
And you could see if when they're giving up, you could see it.
Mm-hmm. Mm-hmm.
So you have to, try to energize them, keep them
Mm-hmm.
going.
Mm-hmm. Right. That's
So,
good advice for the loved ones. If you have someone with cancer, do what you can, like you
yeah,
said, to help them get a positive attitude and feel that they can overcome it. Some people need a little more assistance than others, right?
yeah.
Mm-hmm.
And a plug for Zoom, that was the
Mm-hmm.
greatest thing.
Mm-hmm.
When the coronavirus came around and we
Mm-hmm.
got that and everybody went on Zoom, we learned
Mm-hmm.
a lot. That was
Mm-hmm.
great.
We did, didn't we? Yeah. So I
Yeah,
remember I knew you in the clinics, and then
yeah,
when Corona came, and then we weren't allowed to have our meetings in the clinics anymore. And thank
yeah,
goodness we were able to access Zoom. And it felt like we were still getting together. I think it's wonderful
yes,
because also when we met in the clinics, usually the people who lived within a good, easy distance would come. But if they lived a few hours away, it's too difficult. But now with Zoom, I know you and myself too, we're on Zooms with people from all over the world, right? Like you have a couple
yes,
of Zoom groups that, didn't you mention there are a couple of that are in different countries
yeah,
even, right?
yeah. New Zealand, Australia,
Uh-huh.
England, Holland,
Mm-hmm. Mm-hmm.
yes.
Yeah.
And you know what's amazing? There's no lag in the talking.
I
When you
know.
talk, we can't figure that out.
Uh-huh. It's like you're right
Isn't it
there in the
so?
next room.
Yes, yes.
Mm-hmm.
So it's a great tool,
Mm-hmm.
and we educate the care they get, like in Australia and England, and even Canada. We have a few people from
Mm-hmm.
Canada. They have the same
Mm-hmm.
health system, and it's
Okay.
very poor. They don't
Mm.
get the same immunotherapy drugs. They don't get the new treatment called TILS. That's
Mm-hmm.
not available. It's just starting now. So, but they don't have very good funding there. You know,
Mm.
they're they dedicate less money towards
Mm-hmm.
finding these cures.
Mm-hmm.
It's not their fault, you know.
Mm-hmm. Yeah, this must be hard sometimes when you see people who don't have access to the things you have access to. But at least
Yeah.
you're helping them with the other side of the equation, their outlook and how they look at things and the things they can do for themselves as well.
Yes,
Mm-hmm.
what's available.
Mm-hmm.
So they have like if they have something wrong and they call their medical facility, they might tell
Mm-hmm.
them, okay, come in 6 months or eight
Oh.
months,
Mm.
and you got a pain.
Mm-hmm.
So it's not good.
Mm-mm. No, it's not. Well, I'm so impressed with how far you've come and all of what you've been through. And you came out on the other side, you've emerged now, and you're helping other people. And I really believe that your helping other people will keep you going too. Because I've seen a lot of survivors, they're giving help and it enhances their life as well. So,
Yes, I do
mm-hmm.
feel better helping other people.
Mm-hmm.
Yes.
Mm-hmm. It's great that you give back
Um,
like this, and I appreciate you sharing all of this today. It'll be up on YouTube and it'll be on Spotify, Apple Podcasts, just as an audio as well. But the
mhm.
video will be on YouTube. And if anybody who's listening wants to get in contact with us, you can go to this email, creation balance. It's two words put together, creation balance at yahoo.com. And you can also find us on YouTube, and you'll be able to email us on YouTube. You make comments, we'll answer you. And if you need any information from Roy, you can go through me to contact him as well. And I think that this is so important. You never know who might be tuning in, and this will be
Yeah,
up there forever. So we'll keep it
yeah,
up there.
yeah.
Okay.
Well, it was so nice talking with you, Dr. Cindy, again.
Thank you.
Been a long time.
It's been
We
a long
lost
time.
a good friend, Jerry. Remember Jerry?
Yes, I do. Yes, I
Uh,
do. And he
uh,
did his best to the very end. I saw him probably 2 weeks before he passed, and he had really so much gratitude for the things in life that had occurred, and that there were some loose ends tied up with some of his family members, and so much gratitude towards his doctors and his family and everyone who had been there for him. So yeah, it was he was a very special man, and yeah, he
yeah,
was a really good group member for everybody. Yeah.
yeah. I went to his funeral. Rob was
Mm-hmm.
there, and
Mm-hmm.
uh, so it was nice. A very moving tribute to
Mm-hmm.
him.
Yeah.
Yeah.
Yeah. Mm-hmm. It's beautiful. Well, we should stay in touch. So,
Yes. Okay,
okay.
Dr. Cindy.
Yeah. Thank you. Very nice to see you.
Yes. Thank you.
Thank you
Bye
again.
bye.
Okay. Bye-bye.